Hey guys, this is Robin, and this is Week 2's Discussion 2 presentation. This week I have been promoted to an Associate Director of a 300-bed facility located in Steubenville, Ohio. I have been asked to meet with the CEO to present a 5-minute slideshow on what possible investment scenarios is needed for that facility, be it renovating our current facility, expanding the facility, or possibly integrating electronic health records into that facility. I requested the CEO consider a full integration of electronic health records, as we have been using paper charting for many years. I am asking for him to meet with me and see all the necessary qualities that it could possibly present to him. As we have learned from the patient surveys, there are a lot of issues that they are having along with the hospital by having recurrent charting issues, that patients have to bring their records from other locations, possibility of losing stuff out of that transition from one facility to another. Duplicate lab tests are being ran, as well as radiology reports are being ran, in addition to lost documents, and also it not being available for the doctors and the lack of communication between the doctors effectively with the patient. That can be a big problem. So a lot of people are wondering what my projected service is going to be. So for me, the clinical integration of electronic health records, improving quality of care for those patients, improving patient satisfaction is number one, obviously, even though we know that we have to get those electronic records together to get that patient satisfaction, and the increase the revenue by improving the facility. By doing that, we're going to increase our facility's patient satisfaction, improve quality of care, which will also increase that patient satisfaction. Some of the disadvantages of not having the electronic health documentation is risk of not having it really is whenever we go to access the chart, there is not a quick way to go through it when it's paper. Sure, we have tabs to look through, but we really have to worry about it being in chronological order. You know, if we want to get into a radiology report, is it there in the correct way? Is there something new that's been added to it? So then we have to flip through the chart, making sure that it's in that proper order. Is it, been a couple of days and now there's been more tests added to it, but I'm looking for something specific. So it tends to be a little bit, time consuming. Also, they need to be managed. Whenever the charts are done with the doctor, the clerk has to then go through it, make sure the orders are processed. The nurses have to sign off on that they've gotten the orders. And there's times when the doctors also have it, and that decreases the productivity. By doing that, they're sharing the chart. The doctor has it for rounds, then the clerk gets it again, the nurses get it. Therefore, there could be a lot of times in between there that orders are missed, or whatever the case may be, so therefore it's an increased workload when things have been missed, and now we're forced to work faster and harder, and things can also cause medical errors. There's also longer billing times because of the doctor possibly not writing the correct ICD-9 codes. Another big problem is security. Anyone has access to that file. When that file goes anywhere or just sits there, anyone can look through that chart, and there's a lot of HIPAA issues that could possibly happen. People can go in and make copies of someone's chart. I may know somebody and be like, oh, you know what? I could use that. I need to make a copy of it. You just never know. Things could get ripped out of the chart, and you just never know what could go missing, and then my stuff is out there floating anywhere on the floor for someone to read. The other big thing is medication errors. Doctors have, and as well as nurses, but mostly doctors have sloppy handwriting because they write fast. They can very easily make medication errors by not writing things out properly, by missing a dot, a zero, anything like that. It can be construed as a wrong medication. The initial benefit of electronic health records is better patient care coordination and disease management. With that, the doctors have the ability to have one-on-one conversations, have those information when they pull it up on the computer, and be able to process things a little bit faster. They can order medications faster, they can order labs faster, have the results faster right there at the touch of their hand and see what's going on with it. Again, fewer medical errors by having exact documentation of what they need. The precise period is put in between numbers if need to be. The increased productivity is the orders are put in right away. The nurses are notified right then and there that they have orders that they need to fulfill versus sitting there for an hour or two while the clerk is going through medical documentations trying to find numerous charts and putting those orders in when there could have been a stat order placed. Some of the long-term benefits, more targeted public health initiatives, more effective preventative health measures, We can know what's going on. We can let the CDC know what's going on. Significant reduction in national health expenditures and a healthier society overall. One of the major advantages of having this is, like I said, overall, we're going to have the possibility of providing accurate, up-to-date, and complete information about patients, quicker access to patient records for more coordinated, efficient care, improved patient and provider interactions and communication, as well as healthcare convenience, enable safer, more reliable prescribing of medications and medical errors, promote legible, complete documentation and accurate, streamlined coding and billing, and reduce costs through decreasing paperwork, improved safety, reduced duplication of tests, and improved health. I hope the CEO likes what my presentation is. I know I went over a couple minutes, but I hope he likes it. I hope he goes with what I like. Thank you guys, and have a great day.